Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
Well, joint replacement can be any of a number of things, but essentially when someone gets arthritis, be it just regular wear and tear type of arthritis or something like rheumatoid arthritis or somebody who's had trauma to a joint, the joint basically loses its ability to function properly. It becomes painful and swollen and deformed, and a joint replacement basically removes the arthritic surfaces of that joint, whether it be a knee, shoulder, hip, somebody's wrist, elbow, and removes the arthritic surfaces and replaces that with some type of metal and plastic usually. And so then, therefore, you take the arthritic surfaces away and now you have a nice functioning joint which doesn't cause pain anymore. The first step for someone who thinks they're a good candidate for joint replacement is to be evaluated by an orthopedic surgeon like myself or one of my partners at Coastal Orthopedics, or to come here to the Conway Medical Center and attend one of the pre-op or pre-educational type joint replacement classes to learn about joint replacement. And generally, in the office, we'll perform a physical exam and do x-rays to determine if the person has arthritis and if it's bad enough. If they've failed conservative treatment and they're still having significant pain, then they'd be a good candidate to have a joint replacement. Once they're scheduled for surgery, we do a very good job at creating a good roadmap for the patient to attend not only their primary care physician to get preoperative clearance to make sure their heart and lungs are able to withstand the surgery, but also the patient will be scheduled for a preoperative visit at the hospital where they can learn about the process of coming to the hospital, undergoing anesthesia, what type of anesthesia they're going to be under at the hospital. They'll also meet with the director of our joint replacement program, with the physical therapists, the case managers, and we do all of that so that there's really no questions about what's going to happen before surgery, during, and after surgery to ensure that everyone runs through this process very smoothly. Over the last 10 years, there have been a lot of changes in joint replacement, and there have been a lot of different things that have changed as far as the surgery, but I think the most beneficial thing in the last 10 years has been the post-operative rehab and the post-operative hospital stay for patients who have had joint replacement. I think we've gotten much better at controlling pain without the use of narcotics, although they still use some. It has greatly diminished the use of narcotics with other types of medicine and regional anesthesia. And the rehabilitation period has gotten much better, and we're getting a lot more, we're returning people to their active lifestyles much quicker and sooner than what they did in the past. And the hospital stay itself, you know, in the past if somebody had a knee replaced, they might stay in the hospital for 4 or 5 days, whereas now our average length of stay is closer to 2 days, and most patients will go home rather than going to a nursing facility or a rehab facility after their surgery.
For more information, visit us online at conwaymedicalcenter.com.